I'm Chuck Scarborough.
And I'm Natalie Pasquarello. We want to tell you about a critical step tonight, a critical step forward in the tri-state reopening. Starting Monday in New Jersey, non-essential retail stores can reopen at 6 a.m., but it is curbside pickup only. No customers will be allowed inside. Non-essential construction can also resume. Governor Murphy says if current downward trends in hospitalizations continue, more restrictions could be lifted. This as the statewide death toll inches closer to 10,000. News 4's Brian Thompson live in Hackensack with what else could be coming down the pike there, Brian.
By the end of this week, we should be hearing about the governor's policy for the beaches, just a week before the Memorial Day weekend, as well as a policy for elective surgery. So, you know, there are a lot of people out there, knee replacements, whatever, who've been waiting for this. But today, it was a day for retail shopping, and as well, it was for construction. And for Governor Murphy, this was an important first step. Retail businesses on main streets across New Jersey, this TNEC, getting the green light to reopen for curbside pickup. But Governor Murphy making clear,
we're still in a stay-at-home mode. We're still stay at home unless you have to go out.
People have indeed been doing that. Look at these empty streets in Hackensack. But listening to some, well, they may stay empty even with the governor's okay to open up.
Even though it's curbside pickup, because you could have curbside pickup and someone's right there without a mask and not being compliant with social distance.
So you're not going there?
Not yet.
Some local officials sharing that fear. I asked Newark Mayor Ras Baraka on the phone this afternoon about his downtown businesses and how they'll operate.
Honestly, I don't know what they're going to do. I don't even want them to be open.
All construction activity can resume as well. We found work happening at this luxury apartment building in Hackensack, one of 9 that have been under construction for weeks despite the partial construction ban. The contractor not responding when I asked over the phone. Can you tell me what part of the executive order that you're following? You hung up on me. Hackensack's mayor also not responding. The city building official not commenting.
I don't see anything in the executive order that allows this. Can you help me with that at all?
Local building trades officials frustrated. Everyone can legally go back to work Monday.
The executive order is clear. All this residential work that has 9 jobs going on in Hackensack should have been shut down on April 10th.
Now, I reached out to a lot of people about how this construction could be happening over the past month, right before the governor's order opening it up on Monday. I asked the county executive, and he explained to me, well, it's home rule. It's the town of Hackensack, or the city of Hackensack, controls this sort of thing. As I said, the mayor wouldn't respond to me. I asked the governor's office and the state police. Again, they said, home rule. This is Hackensack's responsibility. So as of now, looks like this construction will be continuing even before it's all opened up by the governor's executive order. Live in Hackensack, Brian Thompson, News 4 New York.
All right, Brian, thank you. The green streak grows in New York. A 4th region now has met Governor Cuomo's metrics to reopen the North Country. Our area is still in the red. We need fewer hospitalizations and deaths and more empty hospital beds to reopen. And today, the New York Department of Labor reported paying $7.4 billion in unemployment claims in the first 7 weeks of the pandemic crisis to 1.7 million New Yorkers. About 1.8 million out-of-work New Yorkers have filed for claims. In New York City, daily hospital and ICU admissions are up. The number of people testing positive, though, is down. And for those who walk or cycle, you'll gain 12 more miles of open streets and 9 more miles of protected bike lanes tomorrow, with virtually no motor vehicles to deal with. And the MTA has started testing new markers at subway stations to improve social distancing. News 4's Rana Davini is live from Lower Manhattan with those details for us. Rana?
Yeah, and Chuck, starting tomorrow, the number of street closures in New York City will double. Most of these roads closed for pedestrians. Some of them also closed, though, for cyclists. Starting tomorrow, Broadway here in the financial district will become a protected bike lane. And Chuck, as you mentioned, some of these changes you're going to notice underground.
X marks the spot on the subway platform. The MTA testing social distancing markers at the 53rd and Lexington subway station, trying to help New Yorkers spread out.
We want to make it easier for people to socially distance, particularly as the warmer weather comes on.
Mayor de Blasio also announcing the third phase of the Open Streets program. 12 more miles of streets will close to traffic across the 5 boroughs starting tomorrow. Some areas like 38th and 39th Streets in Manhattan will be reserved for a protected bike lane.
I think it's a no-brainer to close the streets to traffic so pedestrians have more room to, enjoy the outdoors safely.
As the city tries to make it easier for people to spread out, growing questions about how social distancing is being enforced. Some saying videos like this one, showing officers tackling and arresting a man in the East Village, points to a bigger problem of racial disparity.
It's not what we want to see, and it's quite frankly disturbing.
The overwhelming majority of social distancing violations have been issued to people of color. The police commissioner not defending it, but pushing back.
I, as the police commissioner, will not stand for excessive force, nor will I stand and defend indefensible.
And they're also floating the idea of a reservation system, having people reserve a space ahead of time on a bus or a subway. Again, just an idea. They're saying everything right now is on the table. Reporting live in the Financial District, Rana Novini, News 4, New York.
All right, Rana, so many changes coming. We thank you for that breakdown there. More than a dozen states are now reporting cases of that rare inflammatory syndrome in young people that the News 4 I-Team was the first to tell you about. Cases of the possible COVID-19 linked illness are growing now in New Jersey and in Connecticut. We know a lot of parents have been concerned about this. New York has at least 102 cases, most in the city. Sadly, 3 young people have died. New Jersey now reporting 18 cases. Connecticut, 5. News 4 Government Affairs reporter Melissa Russo has the latest.
12-year-old Giselle Rosario was grateful for the warm send-off after 21 scary days at Newark Beth Israel Medical Center. Most of all, she's grateful to be alive.
I almost died.
In mid-April, Giselle and her mom say they'd been staying home, social distancing, working hard to avoid exposure. Then Giselle started having pain and swelling in her leg and foot. Her mom says urgent care misdiagnosed it, and they lost precious time while avoiding the hospital.
I was very scared to go to the hospital. I didn't think this was COVID-19 related.
Turned out Giselle had a dangerous blood clot, and during a procedure to treat it, she went into cardiac arrest. After 45 minutes of CPR, she ended up on life support. Little did they know, while Giselle never experienced any typical COVID-19 symptoms, she tested positive for the antibodies.
She's been exposed to COVID. That's what I'm thinking, that she had the virus before.
Governor Phil Murphy today said New Jersey has seen 18 cases of pediatric inflammatory syndrome, which doctors believe is an extreme immune response to COVID-19 that can cause recurring fever, rashes, abdominal pain, and inflamed organs like the heart and kidneys.
70% of the cases went into ICU, which means they're serious. We have lost 3 children in New York because of this.
Governor Andrew Cuomo says New York's number is up to 102 children. In Connecticut, Yale New Haven Medical Center says they have 4 cases.
Our 4 patients are doing okay right now, but we continue to watch this with concern.
And I keep saying to parents and family members, I need you to be vigilant.
Don't put yourself at risk. Don't put your kids at risk, and others as well. Like, I see people that are outside, they're not wearing masks. I am very happy, very excited that I get to come home. Spend time with my mommy and my grandma.
The New York State Health Department is now partnering with the New York Genome Center and Rockefeller University to try to determine if there's a genetic basis for this new illness impacting children throughout our area. Melissa Russo, News 4 New York.
Connecticut's governor just wrapped up his daily briefing, and he says the state sent out an alert to all medical providers asking them to report cases of that pediatric syndrome. The state is now reporting 522 new cases of coronavirus and 84 new deaths. And the number of people in the hospital continues to drop in Connecticut. We are 1 week away from Connecticut taking its first steps toward reopening the state's economy. The governor addressed concerns about residents from neighboring states traveling to Connecticut to take advantage of open stores and restaurants.
As you know, we closed our restaurants and bars in conjunction with our neighboring states, in particular New York. We're talking to New York as well as Rhode Island, which is doing their outside dining at the same time, to see what else we can do on a regional basis.
Hair salons and barber shops are also among businesses that will reopen next week.